My final video is going to demonstrate the interview process, which I think I have memorized. So I'll get started. Hi, my name is Poonam Manik. I'm the nurse practitioner student here at Midwestern University. And I'm going to gather my supplies and sanitize my hands. Can we start off with your name, date of birth, gender, and gender identity, please? What brings you in today? What's your chief complaint? What is the onset, location, duration, characteristics, radiating, aggravating factors, relieving factors, timing, and severity? We're going to move on to medical history. Can you tell me about your medical history, please? Can you tell me a little bit more about your surgical history? Obstetric history? Do you have any implanted devices such as PICC lines or med ports? Are you on any medication, prescribed over-the-counter or supplements? If so, which medications, frequency, dosage? Do you use more than one pharmacy? If so, why? Do you have any allergies to medication, food, or latex? Do you see a specialist, like an endocrinologist or cardiologist? Okay, we're going to move on to family history. Do you have a family history of bleeding disorders? A family history of neurologic disorders? Any family history of cardiac conditions? Any family history of cancer? Any family history of endocrine disorders? Then we're going to move on to personal and social history. What is your current occupation? Do you live alone? What is your housing situation? Do you have a partner or spouse? Do you have any history of military service? Are you able to afford your monthly expenses? Do you have a faith-based orientation? Do you smoke? If so, how many and for how long? Do you drink alcohol? If so, frequency and amount? Do you use illicit drugs? If so, frequency, amount, and method of administration. Then we're going to move on to review of systems. Skin. Do you have any rashes, sores, lesions, dryness, itchiness, or changes in skin color, or lumps or changes in skin color? Do you have any moles that have changed in size or color? For the head, do you suffer from any headaches, dizziness, or head trauma? Eyes, do you have any changes in vision? Do you wear contact lenses or glasses? Ears, do you have any changes in hearing? Any earache, tinnitus, discharge from the ears, ear pain, ear infections? And do you wear a hearing aid? Nose and sinuses, do you suffer from colds frequently? Any nasal congestion, stuffiness, discharge, and any nosebleeds? Okay, then we're going to move to mouth and neck. When was your last dental exam? Do you have any teeth or oral pain? Loose teeth, decayed teeth, chipped teeth, broken teeth? Any difficulty chewing, tasting, or swallowing? Any pain or stiffness in your neck? Any swollen glands? We're going to move to breast. Do you have any lumps, pain, or discharge, discomfort in your breast? Do you have a prosthesis or augmentation of the breast? Do you perform self-breast exams? If not, I would educate them on how to perform a self-breast exam. I'm going to move on to respiratory. Do you have a cough? If so, is it productive or dry? If there's a productive cough, what is the color of the sputum? Is there any blood in the sputum? Do you have any difficulty breathing during rest? Do you have any difficulty breathing or shortness of breath
Yes, I do.
during rest and during activity? And do you wear a CPAP? Then we're going to move on to cardiovascular. Have you ever been told you have high blood pressure? Do you wear a pacemaker? Do you have a history of murmurs or abnormal heartbeats? Do you have any heart palpitations? Do you have difficulty breathing when you're laying flat, which would indicate orthopnea? Any shortness of breath and any swelling in the feet and ankles? Then we're going to move on to gastrointestinal. Do you have any acid reflux? Any changes in appetite? Any nausea or vomiting? When was your last bowel movement? What was the color and consistency? Do you have any pain during defecation? Do you suffer from any rectal bleeding or hemorrhoids? What is your diet? Do you have any dietary restrictions or allergies? I'm going to move on to urinary. Do you have any pain, burning, or discomfort during urination? Any blood in the urine? Any history of urinary tract infections, kidney infections, or kidney stones? Do you wake up to urinate at night? If so, how many times? Do you have any urinary incontinence? Do you use a catheter? If so, indwelling or external? Then I'm going to move on to female genital. When was your last menstrual period? When did you begin menstruating? Could you be pregnant? How many children do you have? Do you have any nipple discharge?